TennCare is our Medicaid program. You can apply for Medicaid for TennCare anytime. There's been some confusion, according to some of the people that in prior groups, that because the healthcare marketplace closed the 31st of March, a lot of people think that TennCare is closed. So you need to say no. If if somebody asks you that question, you can apply for TennCare anytime. It is now through the marketplace website or through that avenue. There's several different groups that qualify. Of course, children under 21 that are financially eligible, low-income pregnant women, parents or caregiver, relatives of minor children, newborn children who were born to Medicaid mothers, medically needy, people who qualify for SSI. The next one is primarily for older adults, usually with the nursing facility, but could be some of your patients that maybe have some disabilities. And then the last one I'm going to talk about in a minute is the breast and cervical cancer program. Then there's TennCare Standard, which is for uninsured that don't meet TennCare standards, but maybe are a little or below 212. And somebody bigger than me may have to answer the question about the medically eligible. If you were uninsurable and met the criteria financially, then you were considered uninsured, then you could apply and receive TennCare. Because of the marketplace and them not being able to turn away anybody for any condition, then I'm not exactly sure how this is going to go, and I haven't talked to anybody who's had anything happen in this area where they had a patient that was uninsurable and applied for TennCare or had a condition, and whether or not that's still going through. The eligibility, of course, is determined by TennCare. There's some Medicare cost-sharing programs that are a part of TennCare for older adults, people on Medicare. How to apply for TennCare. The TennCare Health Connection is a number that you can call and get assistance with applying for TennCare or questions about TennCare. The Insurance Marketplace number is that federal number. That's for the marketplace, that 800-318-2596. And of course, you can apply for through the Insurance Marketplace. That's where TennCare applicants apply now. All of them have access to the internet, so they do have availability. Used to before we sent them to the Department of Human Services to fill out the application. They're not filling out the application anymore, but my understanding is they have access to computers that they can use to apply for TennCare at the DHS office. So if you have someone who doesn't have access to the internet, they can go to the DHS office and still apply at the DHS office. It's just through the internet. And then you can, of course, print an application. You also can call the 1-800 number, and they will mail an application to you. So that's for some of your patients that may not feel comfortable using the internet or have some issues with literacy, then that may be the best option for them. It's just to call and get that printed application. Covered Kids is another program that we have available to those that qualify for 18 and younger. The household incomes of 250% of poverty. There can be a buy-in for children with higher incomes. You have to be a Tennessee resident. There's what they call Go Bear. You have to be without coverage for 3 months before you can get onto Covered Kids, unless you're coming off TennCare and going on to Covered Kids, then there doesn't have to be a lapse in coverage. Or if you're coming from another state where you are on an S-CHIP program and you come to Tennessee, you don't have to wait the 3 months to get on Covered Kids. You're screened first for TennCare before you can apply for Cover Kids. So you're screened for TennCare eligibility first, and other state-sponsored insurance. And there's maternity coverage for pregnant women at or below 250% of poverty who meet the eligibility criteria. Cover Kids can be your only health plan. It can't be a secondary insurance. Tennessee Healthy Babies can cover pregnant women who do not have maternity coverage. They may have health insurance, but it may not have maternity benefits. So they can apply for Healthy Babies Tennessee, but again, that can't be a secondary coverage. They have to have no maternity coverage. Cover RX is a program to assist in getting prescriptions for people without insurance. It's Tennessee residents only, 19 to 64. You have to be a U.S. citizen or a legal alien. The household income has to be below the poverty level. They can't have any pharmacy coverage from TennCare or an employee insurance, but they can participate in other discount programs. There are a lot of discount programs through groups available in various ways. I know when I was at the health department in Williamson County, our county mayor applied through the National Association of City and County Officials and got a discount card for the citizens of Williamson County through that organization. So there are lots of organizations that offer discount cards. Effective January the 1st of this year, individuals with a household income below 100% of poverty would only be the ones that would be eligible for Cover RX. And that was a change. To apply for, these are where you can get the applications for Cover Kids and TennCare. My understanding is, though, to get Cover Kids, you're going to have to apply for TennCare. They're going to have to they're going to screen you to see if you qualify for TennCare. If you don't, then they're going to say you don't qualify for TennCare, but you may qualify for Cover Kids. Of course, the federal poverty rates. This is a nice little chart you can pull up on the internet if you just Google federal poverty rates. It gives you the annual guidelines, and a lot of the programs, federal and state, do have income guidelines. And this generally changes the month of April. So usually if you look at it now, check it again after the 1st of May, because normally they in the history when I was working and pulling these off, we usually always got a new one in April, sometime in April. Of course, the health insurance marketplace, you got the 1-8 number you can call and get an application mailed to you. You can go on the website and apply online, or you can print an application. The enrollment ended for the private insurance marketplace on the 31st of March. Open enrollment for 2015 begins November the 15th of 2014 and will run through February the 15th of 2015. However, there is a special enrollment. If you have certain changes in your life that meet their criteria, then you can go ahead and apply through the marketplace for private insurance within 60 days of that event. Changes in life status include marriage, birth of a child, loss of health coverage. There are certain things that help you qualify so you can go on and apply and not have to wait till November. Health Assist Tennessee is a great resource for yourself and for your patients. When we did the 211 top needs for a lot of the counties, patient advocacy navigating the health system came to the top in many counties or was in the top 10. This is a good place to send people who have difficulty navigating through the healthcare system. Health Assist Tennessee is actually housed in the same organization that houses 211. It's all under Family and Children's Service, but they have bilingual staff that can talk with the patients if they have other languages that you may not have access to. They will help them with medical care, dental care, vision, medications. They even do Medicare, questions about Part D. You may have a grandparent who brings a child in who has questions about their Medicare. And because you're in healthcare, you're the expert on everything, so they're going to ask you. But that's just a good thing to have access to. This is another critical access point, the crisis line. This is through the Department of Mental Health and Substance Abuse Services. There are different agencies across the state that man these phone numbers. But prior to this number, and this has happened not too long ago, you would have to know that individual number where you are. Now they have this 1-855-CRISIS-1 that's kind of, you call that number and it will automatically funnel you to where you need to go. As far as it will send you to that provider in your area that has that crisis line, and that crisis counselor will help that patient or help that patient navigate through the system if they're having a mental health or substance abuse crisis. So that's that's a good one to have. I think in your bags there may be a little square magnet that has that number on it. TADIS is another just good resource to have. It's a clearinghouse for alcohol, drug, and other addiction services. They do training, and they have bukus of materials. If you've got adolescents in your practice, if you have parents of adolescents in your practice, and you need information on alcohol, drug, or other addiction services, this is a good place. You call, you tell them what you need, and they will mail it to you. How many times have you had a child come in and talk about some drug that you didn't have a clue as to what they were saying? This is a good place to call and say, what is this? And do I need to be worried about this? Because the language in that world changes very rapidly. So what we think we know one thing is called today, it might not be called that tomorrow. Patient assistance programs, these are one of the things that we tapped into a lot. And in doing my research, one of the great places that I found is kind of like Tennessee Disability Pathfinders and 211. NeedyMeds.org is an organization, and their sole purpose is to gather all the information out there about all the patient assistance programs and put them in one place. So they are a repository, and they have an entire staff who research this daily and have contacts with these organizations, and you can sign up for their listserv for a daily email or a weekly email about changes in this program. But when they send that out, they're also updating their website. This is the Needy Meds, the front page of the Needy Meds website. Like I said, I've just been real impressed, and from the people that I've talked to, this has been a real benefit for their patients that didn't have a way to get insurance. And depending on the program, there are also programs that will help with co-pays for people who do have insurance. So if you see the tab that says patient savings, if you click on that tab, the first thing you see under there is prescription assistance, brand name drugs, generic drugs. To me, this is the easiest. You can navigate all over this website, but to me, if you're looking for a particular drug, this is the quickest and the easiest. We got a brand name drug. We pull it up at the top of the website, which you can't really see here, is the alphabet, A through Z. All you have to do is click on the first letter of the drug that you're looking for, and you will get all the drugs that start with that letter. You scroll down and click on the one you want. You'll notice this program is a foundation program, and it offers, you may have insurance, you have to be 400% of poverty, but all of these pages will have the organization who's sponsoring this program, it'll have the application, it will have, most of the time it has an income calculator so you can see if the patient will qualify, it will have whether they can have insurance or not, what the eligibility as far as income, if there is, it has all the information to make as to what those patients can do to be eligible. The one thing that I was told by the people who use this frequently is don't hesitate to call and pick up the phone and call the numbers that are on these pages, because the people at those phone numbers are there to help you through this program. So they said that every time they have called that they have been exceptionally pleased with the person on the other end of the phone that was trying to get them help. This is another example. If you look at the very top of that program of that page, you'll see this says program 1 of 2. So that means there's actually 2 patient assistance programs for this drug. This first one is from the drug company, from Merck, and it has the application on here. You can see Merck Patient Assistance Program in English and Spanish. It will give you the income eligibility requirements. I love that case by case. Case by case means I can call and I can talk to them, and usually if you can call and talk to somebody and plead your case, when they say a case-by-case basis, then you're probably more likely to get what you want. So, like I said, it never hurts to call. This is a sample of the Merck application. It's a paper application. The one thing with all these programs is the patient will have to have the prescription from the physician, and they have to send that in with the patient unless it's a program that helps with copays. If you have insurance, there are programs on this website that will help you with your copay. And if you go get the medication and you pay your copay, you may be able to send in your receipt that you paid that copay, and they will reimburse you fully or partially for that copay.
Does this work for controlled substances as well?
It depends on the substance.
Well, it's like an ADHD.
Well, that's my next one. There's the second program for the asthmatics, Twist-Taylor. Here's Concerta is on there. So there are some. They're not all on here, but there are certain ones. The other thing with many of these patient assistance programs, some of them will mail the medications to the patient's home, but a lot of the ones that we encountered, they will only mail them to the physician's office. So if this is one of the things that you choose to help your patient, you'll kind of have to put in a little system, and it doesn't have to be elaborate. We did a little box and card thing where we just kept up with when we sent the application in, when the medication came in, and when the patient picked it up. That way, you can follow through. If they don't get it, then you can call and say, did this person qualify or did they not qualify? Just kind of follow up on it. But then we had a system in place, kind of a designated process of when a patient came in to pick up their patient assistance program, that they didn't have to sit and wait, for everything. We could get them in and out of the clinic fairly quickly. But a lot of them will come to the physician's office. There's the Concerta, is a Johnson & Johnson program. And let's see. This is Advair. This is one of, if you look back up at the top, see where it says 1 of 3? So there's actually 3 patient assistance programs for this drug. Like I said, some of them are copay reimbursement. Some of them will send you the medication. This is the same drug except GlaxoSmithKline. Some drug companies use a umbrella to actually implement their patient assistance program. So you may be getting a medication that's manufactured by GlaxoSmithKline, but Bridges to Access is doing the paperwork. This is the application for Glaxo. Dispensary is Hope. That's kind of the needy meds. I encourage you just to go on there. They just revamped their website. In fact, I had done my presentation and had it all ready, and then they do webinars. And so I watched one of their webinars, and they had totally redone their website, so I had to go back and redo my presentation. But it was good for me because Things change, it's good to keep up. But it's a very easy website to access if you're just looking for a particular drug to help a patient. Dispensary of Hope works with healthcare providers and clinics and pharmaceutical companies. They use overstock, overproduction, samples, and they kind of pull them all together into a warehouse and then dispense them out. And they primarily, they were for a long time housed in Nashville, but they actually have access sites now out in different communities. These are their access sites. If you go to their website, you can actually see the clinics where these access sites are located. This is kind of one of those that came under the radar that I found out about from somebody who was my school health administrator. Sightforstudents.org. A lot of children have health insurance, but it doesn't cover vision and glasses. So this is one organization where they had been successful for getting eye exams and glasses for low-income uninsured children. The community partner piece of it, when you print off the application, you basically have to take it to one of these community partners and they have to agree to be your community partner on getting this child this service. So every county has Head Start, most every school system has a school nurse, a lot of places have boys and girls clubs, so it wasn't really difficult for us to find that community partner. I'm going to real quickly go through some health department resources. A lot of you in here are health department people, so y'all all know these. But in the first session, I had a couple of health department ladies in the back, and I started talking, and their eyes got about this big, and I saw them. Do you know about that? Do you know about that? And so there were programs that they didn't know about. And I wouldn't have known about them had I not knew the people that worked in them and then started asking questions. Family Health and Wellness, Dr. Mike Warren is going to talk in the morning. He's going to cover most everything, but I have to talk about my favorite program. That's the WIC program. WIC is a great program for pregnant, breastfeeding women and young children who meet the financial criteria. They get vouchers for certain food items. They're done as packages, and it provides supplemental food. I did the dance when they added fruits and vegetables to the WIC package. Did we all not do the dance? That was just, I said, that's the greatest thing since whole wheat bread. Qualifications for WIC, 185% of the federal poverty level. This WIC is actually done at the health department in Tennessee. So if you have a patient, a client that you feel like might qualify for WIC, then you just need to have them call the health department, set an appointment. They will have to verify that they live in Tennessee. They will have to verify their income. This is one of the programs that does, you have to have income, actually they have to verify what their income is. For women, you have to be pregnant or breastfeeding, but this is a wonderful way to encourage mothers to breastfeed because the breastfeeding package that they get is wonderful. And it's so expensive if you're totally breastfeeding versus partially breastfeeding. So that was one of we always tried to of course, we were always breastfeeding advocates, but that was one of the things that we could say, hey, you need to look at this package that you could get if you breastfeed. The breast and cervical cancer program, you may have a family there, a mom who's there with her child, who's just come back and has had a mammogram that's come back abnormal. And she may not be able to handle what's going on with her child because all she can think about is how is she going to get what she needs to address that abnormal mammogram. So just to know about this program is kind of my goal. It provides screening and follow-up tests for those who have suspicious results. If a woman is diagnosed with breast or cervical cancer or precancerous conditions, they get enrolled into that TennCare. And they can get TennCare to cover those services. And we have taken women all the way from a mammogram to surgery and all sorts of treatment, and the only way they would have gotten those services is by getting on the breast and cervical cancer program. In fact, I hired a nurse assistant for a health department, and one of the reasons that she wanted to come to work for the health department is because the breast and cervical cancer program had saved her mother's life. And she said, I want to help like y'all helped my mother. There are eligibility requirements for BCS, 40 and 64, 250% of poverty or less. There are age limits. However, for screening, it's 50 to 64, but if you have a family history of breast cancer, then the screening drops back to 40. 40 and older can receive Pap test or other needed cervical services. And then if women are younger than 40 and meet the eligibility requirements for diagnosis and treatment, if they have suspicious results from a screening service. So it's just a really good thing to know is out there and can be a help for your families. State hemophilia program, this is one of those hidden jewels. Like I said, I didn't know the program existed but I knew the person that worked in it, so I started asking questions. But this is a state program. There is a pot of money there. It's not huge. But if you have families that are suffering with hemophilia, then this could be a support for them. There are certain services that they can get through this program, and there's not any age limit for this program. That was one of the things I called and asked, because I said, we're primarily talking about children. I said, so is there an age limit? And they said no. So you can see the services that are covered through the state hemophilia program. There's also a renal disease program, very similar. There's a criteria for financial eligibility, but it covers cost of prescription over-the-counter drugs required for treatment of end-stage renal disease. It can help with premiums. It actually, and I thought this was a very interesting, it will cover the cost of a dental evaluation and up to $500 on recommended restorative work. So it's very difficult sometimes to get access to dental care, especially for adults. Those programs, just a quick and dirty about what the eligibility percentage of federal poverty level is, so you can see it varies by program. I'm going to kind of go off of the programs that you have to be financially eligible and just touch on a few programs that kind of go across the board. Dr. Warren's going to talk about this one tomorrow. The HUGS program is a targeted case management program that sends home visitors into the home to work with the family, the pregnant mom, or women with young children. And there are a lot of moms out there that are very young that are not sure what to do. These home visitors can go in, they can help them make appointments for prenatal care. They can go with them to the appointment if they want them to. So they can be their support system. They can help them find resources if they need housing. They're kind of a case management program. They reach out to go and try to find other resources to help this family. I delivered a couch to one of these families because my HUGS worker said they needed one. So we found somebody who donated a couch and we hauled it in somebody's car and took it over there. So they really go above and beyond to really help these families. The other thing that I really think is neat about this program is once the child is there, the home visitor goes back, they work with the parent, they help them learn activities that they can do with that child to help with their development and to assess their development as they go.
Could you differentiate Nurses for Newborns and HUGS, or crossover or regional difference?
Well, Nurses for Newborns is only Middle Tennessee. So HUGS is across the state. And there's either a HUGS worker or a partial one. In some of the smaller counties, they may share a county. So there probably is some overlap, but this is one of the things that covers the entire state.
State Health Department?
The Nurses for Newborns is not Health Department. This is actually a federal program that comes through the Health Department. So that's kind of the difference in that one. I think hugs may go to age 5. And I don't know that nurses and newborns goes that high in age. Of course, family planning, health department services are available, especially for your adolescent population. Family planning services at the health department are confidential. So if you have an adolescent that doesn't want to talk to their mom about birth control or other issues, then they can go to the health department, they can receive birth control, STD treatment, and it's all confidential. The traumatic brain injury program is another one of those little hidden jewels. They have a toll-free number. They have service coordinators who can help families and victims of TBI to get the services that they need, help them get a comprehensive plan of care. This really hits home with me. I had a coworker, I didn't realize, I had always heard of traumatic brain injury. I'd worked with the traumatic brain injury people for years. But I had a coworker who was in a car accident as an adult. And I was just devastated by the changes that occurred because of that accident. She looked fine to look at her, but there were some definite effects that were lifelong because of that accident. So that is something, and unfortunately, I'm not sure that she got the treatment that she needed quick enough. So I think being aware of the availability of, if you're not sure what to do, having somebody to call and ask is just something that's good to know. Of course, we have our communicable, or they are communicable in environmental disease and emergency preparedness. If you report a disease, that's where it goes for those reportable diseases. I've done pertussis outbreaks on Friday afternoon at 4:30. They always come in. Our emergencies. You may or may not know that the department has a surveillance program, and they look at hospital emergency room data from hospitals, and they track trends in fever, all sorts of, they call it syndromic surveillance. So they're always constantly looking at symptoms across the gamut to see if there are any spikes in symptoms, to kind of be on top of if there's an emerging infection out there. Again, this is where the sexually transmitted infection program is. But again, if you have an adolescent that's concerned about that, you can send them to the local health department if they don't want their health insurance to know that they're being tested. If you send them to the health department, they can do that confidentially. Health statistics, this is one of my favorites. Not everybody loves this, but I'm a data nerd. So I love to go on their website and look at all. There's so much data on the health statistic website. They have licensure data, they have behavior risk factor data. The only thing about the behavior risk factor data is it's not always county specific. Sometimes they get a sample large enough to do by region, some of the larger counties, but usually it's only state. I'm hoping as we expand and grow that's actually a federal program that states implement. And so, but it's that survey that calls people and asks them about their health habits. Hospital discharge data, traumatic brain injury data. There's actually, too, a searchable website on the health statistics page that's called Health Information Tennessee. And it has birth data, death data, population data, facility data. But it's searchable if you want to go in and see how many deaths have happened in your county from a certain, from heart disease, then you can go in and put your county and the dates you want to search and your what you're looking at, and it will give you that information. You can compare it to your neighbor county, you can compare it to the region and the state. So it's really just a kind of a neat thing to know that's there if you're working on a project. And last but not least, Dr. Warren's going to cover this one tomorrow, but I'm going to give it an extra plug. Kids Central is a new searchable database that's been developed by the state. Governor Haslam and the First Lady This is one of their initiatives, and I was skeptical, but I've been really impressed in the ease of use of this website and the information that's on it. One of the things that I learned in one of the other sessions that had heard the First Lady speak about Kids Central is that the top 4 bars that you see, those things, they did surveys of families, 2,000 families, to find out what they wanted to know, so that it would be made useful for them. And those were the top 4 categories that came out of that surveys that families felt like they needed help with.